over 5 million people sustain a knee injury each year?
No.
Okay, from Osgood slaughters, which translates to water on the knees, to arthritis, which is the inflammation of a joint or many joints. People of all age groups sustain knee injuries. Have any of you had the misfortune of sustaining a knee injury? Show of hands. Yeah. All right, so a couple of you. Well, my name is Dominique.mp4. And I personally suffered from what is known as a torn anterior cruciate ligament in both of my knees. No, nobody know? Okay, that translates to torn ACL. Okay, so as I said, many people of all age groups sustain knee injuries. So today I'm going to talk to you about the most common three in terms of what they are, how they happen, and the rehabilitation and recovery process after one sustains a knee injury. So the three knee injuries I'm going to talk about today are patellar tendonitis, also known as jumper's knee. Then I'll talk about meniscal tears, which is also cartilage damage. And then lastly, I'll talk to you about the ACL tear. And at the end of this presentation, I hope that you all have a better understanding of knee injuries and their commonalities. So patellar tendonitis, also known as jumper's knee. Tendonitis is the inflammation of the tendons, and patella is the kneecap. So patellar tendonitis is the inflammation of the kneecap. And this is most common in sprinters, runners, jumpers, people that have a lot of wear and tear to their body. If you look at the MRI up there, you'll see an arrow pointing to a white blurry area. That should be black all the way through, so the white area tells us that there is inflammation and irritation. And the diagram next to it is pointing to the site of where tendonitis occurs. Okay, and the rehabilitation and recovery process for tendonitis depends on the severity of the case. For less severe cases, you'll see people with knee braces or icing their knees, resting, elevating. And more severe cases would require surgery. Some surgeons do recommend draining your knee, get that excess fluid out. They'll stick a needle inside of your knee, and they'll drain the excess liquid out, so the inflammation and irritation is not there or as prevalent there. Now that I talked to you all about tendonitis, I'm next going to talk to you about meniscal tears and cartilage damage. So each of our knees has two menisci, which are C-shaped pieces of cartilage, according to the Mayo Clinic staff. And these are between the thigh bone and the shin bone, and they act as shock absorbers. So meniscus tears are common in people that are athletes, do a lot of pivoting, twisting, kneeling, squatting, etc. And meniscus tears happen, and when they happen, people's knees are going to automatically swell up, get inflamed. They're usually not going to be able to bend their knee, straighten their knee, put weight onto their knee. And the rehabilitation and recovery process for a meniscal tear also depends on a person's tolerance of pain. And I personally know somebody, her name is Brittany Conger. She now plays for the University of San Diego. And she tore her meniscus halfway through her basketball season. It was her senior year. She didn't want to get surgery and risk sitting out the rest of her senior year. So she actually continued to play on it. It does, like I said, depend on your tolerance of pain. But when you do want to eventually get surgery with a meniscal tear. So as you can see in the slide shown above, that's what a torn meniscus looks like. It should be a smooth piece of cartilage all the way through. You can see there's an abrasion in that area, so that shows a torn meniscus. And this is what's called arthroscopic surgery. They put two incisions on either side of your kneecaps. They insert a probe and they insert a camera, and they go ahead and they repair it that way. Rehabilitation for meniscal tears can take anywhere from as little as 6 weeks. So now that I've told you about meniscal tears and cartilage damage, I'm last going to talk to you about the most dreaded of the three, which is the anterior cruciate ligament tear. Okay, according to esteemed dietitian Liz Coleman, over 150,000 ACL-related injuries happen each year, and this accounts for over $500 million in United States healthcare costs. The anterior cruciate ligament is the ligament that connects the femur to the tibia and is the main stabilizing joint of the knee. ACL tears occur when people shift directions too quickly or stop too suddenly, and you'll usually hear a pop or a crack when that happens. It's pretty painful. The person won't be able to put any weight onto their knee. They won't be able to straighten their knee, bend their knee, etc. And as you can see, what the top picture is what a normal ACL should look like. The bottom one is what a torn ACL looks like, so you want to get that repaired, right? All right. So again, you would do what's called arthroscopic surgery. There are two options for this. You can use a human cadaver, or you can use your own tissue, which would be your hamstring. So a human cadaver, there's pros and cons to using both. With a human cadaver, the pros of it are that it's not your own tissue, so it's not going to be as painful as a recovery, but it is going to take a little longer because it's not your own tissue. With the hamstring, the pros of using your hamstring are it's your tissue, so your body's going to automatically conform to it. It's going to be a lot more painful because they did just shave off half of your hamstring. And after reconstructive surgery for an ACL, it can take up to anywhere from 6 to 9 months for that to heal. So in conclusion, I told you all about patellar tendonitis, meniscal tears, and anterior cruciate ligament tears, and in terms of what they are, how it happens, and the rehabilitation and recovery process. And I hope that you all have a better understanding of knee injuries.